Hello, I'm Kristen Johnston, and along with my dear friend and colleague Sherry Chapman, we will be presenting From the Classroom to the Clinic, an innovation to impacting health inequities. We have no disclosures. First, let's talk about the beginning. About 3.5 years ago, a dear friend of mine who's an internal medicine physician and I were on our way to New Orleans to meet our youth group who were serving there in the pouring down rain. And so as we drove, we talked. We talked about our lives. We talked about our passions. We talked about what we loved. And we found quickly that many of those things matched. And we wanted to serve in a different way than we were serving in where we were employed. So we thought about a mobile clinic. We thought about a medical clinic in a church. We just were brainstorming. So we met with some people at our church to share our vision. The way our vision started was we really had a few things that we just definitely wanted. We wanted high school kids and college kids who had interest in medical professions and also who had language skills to work alongside adults that were in these professions or using their language skills so that they could see how your work can be a calling in a ministry. We also wanted to serve the needs of the people that did not have health care close to our church and in the surrounding communities. And so we thought we would start with primary care. We wanted to provide guidance for medical mission trips as people wanted to go to Africa or if they wanted to go to a Latin American country, we wanted to provide the guidance that they would need. We really started wanting to provide health care and meet physical needs so that we could have spiritual conversation and meet spiritual needs, because we know that praying for patients and meeting spiritual needs is part of physical healing. Ultimately, we wanted to see people grow in their faith. And so these are the ways that we started, and you'll see where we end up. So the first thing we did was identify the need. We thought the need would be for physical medical care. And as we investigated, we realized maybe that wasn't exactly the need. The need was the services were there, but the folks didn't know how to connect to those services. So we met with a wonderful man and his wife. They're former missionaries, and they are now serving in the States. And they have a Latino church that's about 15 minutes from our church. So we met with them and we said, what are the needs that you have in your church? And so from that, we had a screening clinic. We actually had a couple of screening clinics at their church. We had eye doctors that came with us, optometrists, we had dentists, we had nurses and doctors that just did screening and teaching. It was fascinating the things that we found out. There were people that were having their medications shipped from their home country. They hadn't had labs done in over a couple of decades. So we really saw there was a need of just connecting with services. So as we identified abnormalities, we would connect with services. There are many services in our area for people that are uninsured and undocumented. So we realized that, and also that being in that church was not a place to provide medical care. We just didn't have the space and the equipment that we needed when we had someone that wasn't feeling well, and we really were struggling with taking good care of her because of the space. So we learned some things from those experiences. We identified that the needs were many things that were not met were mental health needs. We saw patients that were struggling. They struggle because of work. They struggle because of life stress. And we see that anxiety and depression are certainly things that are so difficult for patients, especially if they're in a culture that stigmatizes mental health. We learned from another Hispanic pastor that many of the people in his congregation have no insurance, close to 90%. They are Spanish speaking, and the stigma of mental health is so intense for them. But he said to us just this week, if you will come and talk to my congregation, your clinic will be packed with clients because they need you. It was such confirmation for us to make a switch. So we had gone down this road of getting labs worked out and getting the space worked out, which I'll show you in a minute. And we had gone through the road of it, talking to EHRs, and we realized that all of these things cost money, which we'll talk about in a minute too. And so it really was just such a shift for us because we simplified our process, but yet are servicing such a great need. So the person standing is the sweet pastor's wife of the Hispanic church, and she is bilingual and just a beautiful person. The person seated with straight hair, that is the physician that I was talking to you about. And then we have our patient, and then of course me. The purpose today is to show the audience how to create a medical clinic in a non-traditional setting to help reduce healthcare inequities in individuals who are experiencing physical and mental health needs. Now, we chose our non-traditional setting as our church, but you could do what we have done in a community center, in a library, any place in your community. I want you to start brainstorming. Think of where you can meet needs. It is so fun and so exciting to see the gratitude of these patients. It's really a blessing to us. So we have a clinic. Now, who will be our patients? Well, we will be serving patients that are 19 to 64 years of age. Now, certainly if someone is younger or older and comes to our clinic, we won't just send them away empty-handed. We have resources and places to connect them. We will be serving people who have primary mental health needs, such as anxiety or depression or panic disorder. The patients that we see will be underinsured or uninsured. In our area, there are providers that are caring for patients that have insurance, but our patients that do not have insurance or have little insurance, they really have a hard time finding a place that's affordable. So we will be that. Our services are all free, even the labs. We will continue to have clinic on the same day as the English second language class at our church because we want to offer our mental health services to the people that we have been offering vision screenings and blood sugar and blood pressure screenings and weight checks. So we want to continue that relationship with those folks. We will also be partnering with some Latino communities close to our clinic and some congregations that are close to our clinic. We have already met with some pastors and talked about presenting in their churches so that we can hopefully eliminate some of the stigma that surrounds mental health and also help them see that we do have treatment and there is hope for them. So how did this all begin? How did this space take place or take shape? We had a donor in our church that donated a large sum of money, and her only stipulation was that it needed to go to medical missions or medical ministry. Well, certainly that's who we are. So our pastors have said, this is how much money you have, make it last as long as you can. So we have really taken that to heart, and we do not spend much money at all. So the classroom became 2 exam rooms, a medication closet, and another closet. We kept the countertop and we kept the cabinets. Those were non-negotiable in the renovation, and those have actually turned out to be great help. The man on the left is one of the people that worked on this project. Our church was so kind to provide the staff that were needed and the workers that were needed in order to make this space beautiful for our patients.
So Kristen talked about and showing you the space, what it looked like when it was being renovated. And so this is what our space looks like. We are so thankful. I know we keep saying that. And it is the most peaceful place that we have been in. I don't know if it's because it's away from our primary work setting or just because it's at a church, although all churches don't have to be necessarily peaceful. But again, we are so thankful. We have a member and a friend who's going to do some artwork for our walls, not to make it busy, but to make it just more inviting and more peaceful. So the cabinets that you see, the upper and lower cabinets, I think the next slide will show you some of the supplies that have been donated. So the picture on the right is one of our clinic spaces. And so that there was a provider who was closing their clinic who donated this exam table. And this is wonderful that there's another exam room that has an identical exam table. And the picture on the left shows you the inside of two of those cabinets that I was talking about, of how we had received all of those donated supplies from a pharmacist, from other medical professionals, from again, providers who were closing their clinic spaces. We, again, just so thankful. We didn't purchase any of those things. They were all donated. Kristen talked about the different resources that you need to consider to have in place when if you're thinking about doing having a similar clinic. The malpractice insurance, we found that while this clinic is a part of our clinical practice day and our employer covers us with malpractice insurance, it wasn't that very individual policy that we wanted to make sure that we had. So this space and our organization for this clinic is sponsoring our malpractice insurance as well as for our collaborative physicians. So I know a lot of nurses have their own, and for us that was the best thing. So that's just one thing up front to make sure that you have in place. We live in the state of Alabama, so right now we have to have a collaborative physician with that agreement, and so we have that all in place. We're waiting for the final approval from for our physician. And an EMR, I think Kristen also mentioned this. I am also in another clinical practice site with serving a similar population. And initially when we got started, we had paper charts and then we progressed to the EMR. So you can do that as well. If you have an EMR in place, that's wonderful. For this particular clinic, we are going to start with paper charts. Our collaborative physician was okay with that. We will have them behind a locked door and then a locked filing cabinet. So again, we're starting slow and we just want to get started. Interpreter services, because of the population that we will be serving, we are in the process of getting all of that worked out. Lab services, we've again been so fortunate where people volunteered their services for us because of the patients that we'll be seeing will not require labs to be drawn frequently and just have a small panel of labs. They again agreed to provide that service for us with the supplies. The medical waste services kind of comes right behind that. And again, we've been fortunate that a member from our church has this particular business and volunteered to provide these services for us at no cost. Again, we're not going to be doing frequent collections, but we're just thankful that even though it's a small amount, they're willing to provide those for us. Resources, again, we're going to be providing kind of mental health services, but we know that people have physical needs as well, and we've talked about having those referral resources in place. We've got a list of names with addresses and phone numbers that we can physically give to patients, and we have been helpful in actually helping people call. Dental, optometry we've seen already, women's health services and primary health services. The counseling services, let me say a little bit more about that. So we will talk to patients and prescribe things that are needed and be there for that particular resource. But we know that we need to have that next step for resource. Even though there's certain diagnoses that we will not treat, we still want to be able to provide resources for people. And so we talked with our collaborative physician to see the resources that she already knew were in our community because she had been in practice. And so we kind of pooled our thoughts to come up with that list of places that we could refer patients to. The spiritual support we want to provide within our clinic with ourselves as providers as well as with volunteers to offer that listening ear to pray with people regardless of their spiritual preference, their religious preference, still respecting their culture and preferences. So that's huge to be able to, we want to provide, but we want to be able to also have those next step services. Before we got started physically in our clinic, on this particular day, there were several areas around the city where different ministries went out and provided community services. At this particular site, it was at a school. They allowed us, one of two sites, school sites, they allowed us to come and set up and provide just basic nursing, medical services, blood glucose checks, blood pressure checks, etc. And so this is a particular group of the ladies who volunteered. I believe these are all nurses. I'm quite sure that they are. There may be one person in there that may not be, but we actually provided those services. And these are things that you may be already doing, or you can think about doing. It just gave us an opportunity to get out into the community so they could see us. We weren't, you have to sometimes just get out of the walls, even though you may get back inside the walls, but people need to see you out in their community. This is another picture of being out in the community serving others. You see the picture of the woman getting her blood pressure checked. And I just want to call your attention just to the bottom of that picture. Underneath that picture, Kristen was at a particular site and with other youth, and they were seeing a patient. This man particularly spoke Spanish, and Kristen's daughter speaks Spanish, and so she was able to interpret for Kristen, and we hope to get her involved in the clinic. She's already been involved as a volunteer, so we want to get her even more involved, just as another resource to help. This is a slide just about more resources. The upper left picture just shows that spiritual support that you can offer. The other two pictures of the dental services. The physician on the right is the one I talked about, the ER physician, and that's also a dentist, and he's been wonderful. And again, you know that patients are going to have physical needs as well, so you want to be able to offer that as well. This is on a particular day where that previous picture I was talking about getting out into the community, and so this was also out in the community providing those services. We've also talked in previous slides about the people that will be coming to the clinic and that have been coming. So this is a picture of our ESL classes, English as a Second Language. And the reason that this picture is here is we, on purpose, scheduled our clinic day for a day that they would be on campus having their classes, so that after their classes, if they needed us, they could come by without having to leave and come back or go to another location. So that has worked really well. The ESL staff has been very supportive. They have promoted our clinic on their Facebook page. One of the ladies will text me, and because we're every other Wednesday, just to make sure she's on the right Wednesday. The first few times we were in clinic, Kristen and I actually went up to the class and introduced ourselves and let them see us so they can put a name with a face. And that was wonderful just to interact with them that way, introducing ourselves. One of the days we went up there and upstairs, and they actually had on their board the medical clinic and their hours. And so that was just encouraging. We knew that they were promoting us, but it was nice seeing that they continued to do that. So we are just very thankful for having that extra support, and just, we're there to help meet their needs again, just to make it convenient for them. So we're just very thankful. Of course, with any endeavor, there are going to be limitations. And one big limitation for Kristen and I was that while we had taken Spanish along the way in our lives, we had not taken it recently. And so we knew that if we wanted to be better communicators with our patients and just try to acclimate ourselves more to their needs, is that we needed to go that extra step. And so we asked and received support from our immediate supervisor, and then received financial support to be able to take this Spanish class at Sanford. And so they paid probably 99% of the course fee, and we paid a small student fee to take the Spanish course. And it has been wonderful. It's been challenging because we're full-time teaching as well as taking Spanish, but it's been good. On this particular day, our instructor was kind enough to let us take her picture as well. So I think we've talked also about some of the limitations. The clinic hours were only there every other week for a certain amount of time. Language we're trying to address with interpreters, and for Kristen and myself also to become more versed in Spanish. And then just addressing those, thinking about the after-hour needs. If someone calls, what should the voicemail say? What are we going to tell patients? How to direct them? Also, follow up with patients is not always seamless, and so we want to try to streamline the process of making sure people get the help that they need when they need it with as little interference as possible. Just kind of try to limit those limitations. So what are the implications to practice? Things that we can encourage you to do that we've already been talking about, things that you may have already been thinking about or you've begun to think about by attending this presentation. So we want to help you to be thinking about how can you fill in the gap for meeting those unmet mental and physical needs of those in your community. Also, we are excited that we see this clinic as being an opportunity or providing an opportunity for an interprofessional clinic, being an interprofessional clinic, having social worker students, physical therapy students. That can certainly be something that we can aspire to provide. Pharmacy students, and certainly nursing students, other students, to be able to help meet the needs of the community. We've already talked about that this particular clinic serves as a clinical practice site for us, and so that opens up an opportunity, not just an interprofessional opportunity for students, but for our own students to have an additional clinical site. And then if you want to start small or just need to start somewhere, think about beginning kind of parish nursing type things that we talked about initially that we've been doing, the blood pressure checks, the weight checks, the vision screening. You can do those kinds of things to get started. We are so thankful that you took the time to listen to our presentation today. And now we would like to take any questions or comments that you have. Thank you.